Hello, everyone. Welcome to Leadership Florida's podcast called The Leadership Exchange. And today I am so excited to have as my guest Adriene McCoy. Adriene is the Senior Vice President and Chief People Officer, love that title, from Baptist Health South Florida. Welcome, Adriene.
Thank you. Thank you, Wendy. It's great to see you. Great to be here.
It's so great. So Adrienne is a member of Leadership Florida's Class 36, a wonderful class. I love that class, and a lifetime member. And she's from the Southeast region, and she's
Yeah.
just lovely. And Adrienne and I have had the opportunity to become really good friends. So Adrienne, we have a sponsor for the Leadership Exchange podcast, and it's Sunshine Ace Hardware. And their motto, as we all know, is Ace is the place with the helpful hardware folks. So, from
Right.
that similar theme, I want you to finish this sentence for me. Baptist Health South is the place with.
Baptist Health South Florida is the place with the most compassionate caregivers, the most welcoming environment as you are being cared for with your healthcare needs. We are the place to make you feel better. Our quality is phenomenal. Our people are committed to well-being, wellness, and really getting you back to what you were doing before you had those particular healthcare challenges.
Wow, Adrienne, I'm feeling really healthy right now, but because of the way you described that, I think I want to check into one of your hospitals.
Please.
'Cause I feel
Well, I
like
don't I don't want you to check in, Wendy, if you don't have to, but
I know.
certainly we've got a lot of other preventative services that are available for our patients.
I'm sure you do. And with that in mind, I want you to tell our viewers and listeners a little bit about Baptist Health South Florida and who are you and what's your demographic reach, your geographic reach, which a little bit about your mission. Just describe to those of us who might not know all there is to know about Baptist Health South Florida about you.
Sure, thank you. Baptist Health is a faith-based healthcare not-for-profit health system in South Florida. We've got 12 hospitals, uh, over 100 outpatient services, everything from physician practices, urgent care, sleep centers, freestanding emergency departments. And really, it's an organization that spans a four-county market in terms of everything from the Florida Keys. We've got two hospitals in the Florida Keys. We have in our core market in Miami a number of hospitals, including our flagship Baptist Hospital, which has been a part of South Florida and really foundational in terms of providing core healthcare in the South Dade area. We also ventured a number of years ago into the Broward County market with our outpatient services. We also have a hospital that we broke ground on a couple of weeks ago in Sunrise,
Oh,
uh, Florida, which doesn't currently have a hospital. And then we've got three hospitals in Palm Beach County. So from Palm Beach to the Florida Keys, we are the largest regional healthcare provider in the hospital and outpatient space. We've got 29,000 employees in our organization right now and thousands of physicians, and really trying to be there for our communities. We are embedded in our communities. We provide a lot of charity care, almost one and a half times what we're able to save in terms of being a not-for-profit. We are investing in our community. And the most important thing, Wendy, is we are growing. We have been growing. I've been with the organization for 18 years, and we've grown every year that I've gotten here. We continue to invest back in our communities and make sure that we're providing the needs. We know that the South Florida market is continuing to grow. This is a very attractive market for people from around the country. We want to make sure when they move here, they can get the best care.
that's I'm aware of your growth because you and I have talked about it and how
Right.
busy you are and it's been incredible, really.
That's
Shifting
great.
gears a little bit, let's talk about what are you looking at right now, not just at Baptist Health South Florida, but just maybe in your field, in
Sure.
general, your sector in general? What is hot and trending? What's important to be focused on? What are some of the key things of change that you're looking at right now?
Yeah, well, I think when you look at healthcare and even just in the space of workforce in general, there are a lot of different dynamics. We know how many different generations we have in the workforce and trying to manage those dynamics, but you're also looking at things like economics as employees deal with more financial challenges? How do you continue to provide them with support, provide them with resources? And then, of course, everybody's talking about AI, right? What is the impact of AI? And really trying to be realistic about what's going to change and what's not going to change, because there's a lot out there about, well, people are going to be replaced and jobs are going to go away. And you really have to get to the point where you are looking at how to augment some things being done, but not automatically going to replacement, because there's a lot of noise out there about that. And it can be very scary for employees. Am I going to be replaced with computers? And we've got to manage that. I think there's a great opportunity for definitely HR practitioners in general to work alongside their technology partners in their organization to really be thoughtful about how individuals are feeling while we're all going through this transition and how work gets done. We had to be there to talk about the human implications of significant change and how do you make sure that people don't feel left out. It was a very interesting article that I was reading recently that talked about the reason people work may primarily in some spaces be for money, but people work for purpose. They work for having something that they can uniquely put their stamp on and say, I did that. When you overwhelm with technology and AI and it's going to remove, people start to feel as though you're going to take that away from them. And you have to acknowledge that. You have to make sure that they're a part of assessing what's possible and then helping to guide them through the development of new skills. What I'm finding with a lot of my colleagues is we're trying to sort of quell the hysteria a little bit around AI, and it feels like an arms race. Everybody's trying to be first. And it's what we have messaged is this is going to help us do our jobs better. Or this will also help us focus on some higher level output that we haven't been able to get to because we were caught in things that were very time intensive, very process driven. And if you can have some of that handled by technology, then that even helps us be better in terms of delivering for the patient, spending more time at the bedside, finding out what the needs are. So I'm personally leaning into it positively and trying to work with the team on how do we develop new skills. And then as we grow as an organization, making sure that we maintain our culture. Baptist Health has been on the Fortune Best Places to Work list for 26 years.
Mhm.
And that's a big deal to us. It's
Big
not the
difference.
reason why we do what we do, but it's certainly acknowledgement that we do the right things and our employees recognize that. And then, similar to what you said about the experience you had coming to Baptist Health, no organization is perfect, but I love hearing people say, I went to your hospital, I went to your outpatient center, and boy, I had a tremendous experience. Everybody can say, I had surgery and I came out and everything was fine. But the icing on the cake is they treated me well. I
Right.
knew I felt cared for. And I can tell you, I personally have been cared for at Baptist Health. And I was telling somebody even less than an hour ago, because of a recent challenge, I said, when I come to Baptist Health, I feel like I'm being taken care of by family. And I want everybody to have that. Family cares about you. Family wants to see you do well. They want to see you get better. And that's what we strive for. We want to provide the most welcoming experience. And then we want you to be treated well with your care, the best doctors, the best nurses. We've got a lot of great healthcare in South Florida. And I don't take anything away from another health system, but we really, really make a big deal about experience.
Yeah.
Patient experience, employee experience. Our employee experience scores are the highest they've ever been.
Oh,
And
wow.
that is because we invest a lot in what that experience looks like. We have coaches for our leaders, developmental programs. So nothing happens just automatically. It is with intention of knowing that if we take care of our employees, they're going to take care of our patients, consumers, and family members in the way that we would like.
It's so great to hear you share all of that emphasis that you're placing on not just the patient, but on your professional development and growth
Right.
and challenges with AI. I mean, it's all knitted together, isn't it? It's really all
Yeah.
one big, one big family that you've got to like, everything has to work together. And so other than AI, and I love to hear you talk about and acknowledging that AI is here, it's here to stay. You've got to embrace it. We've got to figure out the right fit. Different from that, set that aside because that's certainly one of today's biggest challenges and
Mhm.
opportunities. I'm going to give it both. But other than that, what are another challenge today that you are experiencing in the healthcare industry and Baptist Health South Florida in particular?
In the South Florida market, there are a lot of people that are moving into our state. There's a tremendous amount of competition for the type of services that we provide. So making sure that our team is knowledgeable, making sure that, as I said, we're delivering on the culture that we want to have. With that growth, there's a lot of opportunity for people both locally and further in the state and out of markets. So, in order for us organizationally to provide a consistent level of care, you've got to have stable leadership, great succession, um, great development and growth in the organization as we are building. We're building, other systems are building. So, how do you maintain the culture, continue to engage the people, deliver on quality? Quality is huge in healthcare. You don't want to have people come to your health system and leave worse than they arrived. So we have to continue to make sure that our quality, we hire the best people, we retain the best people, we develop and engage them, and that we continue to evolve as an industry. Healthcare is always changing. Technology is not just changing how people work, it's changing with new innovations and how care is delivered. So, how do we as an organization stay in step with those changes and the cost of care? The cost of care over time is going to continue to be a challenge
Yeah.
in a lot of different spaces. So, we work on that. We try to make sure that we're providing the best care um, for the most effective um, opportunities that people have to get treated, get home when they need to get home, so that they can get back to their lives. But that's it, growing while maintaining culture, while keeping an engaged workforce and providing quality care.
Those are big, big, important issues and needs that you've got to be focused on all the time. I totally get it.
Yeah.
All right, so I'm going to shift a little bit here, and this is sort of cheating because you are the chief people officer. So you should have a very good answer to this question,
Yes,
but I'm going to turn it around a little bit. I want you to tell me about what it's like to be a Baptist Health South Florida employee, but not just what you love most, but what do you think your people, you are the chief people officer, what do you
sure.
think your team members throughout your 26,000, you said, or something like
29. Uh-huh.
29,000. I don't know what
Yeah.
shortchange, but your 29,000 employees, what in by and large would they say they love the most about working for Baptist Health South Florida?
Working for an organization that's well respected is kind of the first step, I would say, and has people wanting to work for Baptist Health. But also, once you get in, seeing the colleagues, seeing your coworkers. People always say, "Oh, individuals they leave for their boss, but they stay for their coworkers." When your boss and your coworker is great at the same time, and the organization has a great reputation, and you are proud of what is delivered, that that just rounds everything. We have development as it relates to your careers. We try to make sure that our compensation and benefits, I don't know of anybody that's always totally comfortable with their compensation, but we do try hard to make sure that we're competitive. We recognize our employees by giving them incentives and so forth that when we win, they win as well. And I think at the end of the day, it's a feeling that, Wendy, it's really hard to put your finger on. When you work with people who have the same mission, who have the same values, who are wanting the patients to get the best care and to be restored back to what they were doing, that is something where you've got everybody rowing in the same direction. Occasionally, you're going to have somebody rowing the other way, and you deal with that. But and you get to see in healthcare the impact of the work that you do. And we try to tie that work, whether you're in a corporate office or whether you're at the bedside, we try to tie the importance of everybody's work to the community, to the care that's being provided as we're supporting caregivers, whether you're in benefits and you're supporting nurses that are at the bedside, you want to do that in a way that has that nurse focused on the patient, not whether or not they can deal with a benefit challenge. So we try to make sure that experience is woven throughout the employee experience from the first time that you get offered the job and you accept the job to your onboarding throughout your ongoing experience. And again, we don't always get it right. No one does. But when there's an opportunity, we try to support the leader in restoring those relationships. And sometimes, someone's not a good fit and we make that decision, but it's really knowing how intentional the organization is about that experience, about growth and knowledge and development, and you see it. You see it every day. Whether there's a CEO doing a town hall, we try to be very transparent. Even in my division, our boss has a couple of town halls where we're just educating people and not just expecting them to have their head down, just go do your job and, do what we ask. We try to make them part of community. So when people are a part of Baptist Health, they feel like they are a part of a community that has a singular mission, and we've done a lot of work to make that happen over the years. A lot of communication, a lot of transparency, a lot of how does this business work?
Yeah.
How do things get done here? And what is your part in it? And you have to do that. You want to bring people along, you want them to be invested. And I learned that a long time ago here. There are people that are so in love with Baptist Health South Florida, and that's the best kind of employee because they take pride. They feel, I wouldn't say like owners because we don't have owners, but you understand what I mean,
Yeah.
where it's your organization. You're proud to recommend your family member. You're proud. I'm proud when I'm sitting in a hospital waiting to be treated. Like this is my organization. And a lot of people have that type of ownership. And when you do, you're going to operate a little bit differently. You're going to see things and think about things that can be approved, and we have to give people voice to share how can I make it better, and we spend a lot of time doing that. We've got all sorts of employee forums and opportunities to find out from our employees how can we make this better. And if nobody ever asks, then you don't
Right.
feel that connection.
That's right. Wow, I understand now, and I always have, why you're so good at your job.
No,
You're
thank
so
you.
committed. It's just great. It's been great having you today, Adrienne. Thank you very much.
Thank you. Thank you for the opportunity to share our organization.
Thank you. That was such a great conversation with Adrienne McCoy, Senior Vice President and Chief People Officer of Baptist Health South Florida, and Adrienne's member of Cornerstone Class 36, a great class. She's also a lifetime member and from the Southeast region. I loved, Adrienne had so much to share, but some of the things she shared with us, I didn't realize they had 12 hospitals, over 100 outpatient services, facilities, 4 county market, 29,000 employees. And we were talking about some of the things that is hot and trending. She talked a lot about the AI impact on the healthcare industry and also the impact on the people, because she is the people officer, the chief people officer. So she's really focused on how it works with people. And they are trying to make sure that as they're integrating AI into their overall strategies and mission, that it's complementing the care they're providing with their people, and the technology is helping with the solutions that are needed for their patients. So I think it's a great blend. They've got the right kind of optics and vision for that, and she's got a lot to share. So thank you so much for listening. This has been the Leadership Exchange, hosted by Leadership Florida and sponsored by Sunshine Ace Hardware.